Hello, everyone. So my name is Rachel Bagby-Langston. I am a registered nurse who's currently studying for her BSN at ECPI University. I created a PowerPoint on my learning contract project on fall prevention. We'll go through that really quickly. Down below is just my statement of authorship, just saying that I created the whole pamphlet or the whole PowerPoint and cited all of the sources that I've used. So the introduction, let me move myself out of the way really quick so I can read this to you. This project was created in my second to last nursing course and introduced a fall prevention pamphlet to my unit so that we could include that education in our nursing practice to see if any changes could be implemented to benefit our unit. And the project included studying 10 nursing journals to find the most utilized fall prevention strategies, then writing an annotated bibliography on those journals. I also read through the current Bon Secours fall prevention policy and the current VHA fall prevention policy and wrote a paper on it. Then finally, I created a fall prevention education pamphlet. So how did I achieve the project goal? The first objective was to analyze the latest literature in those 10 nursing journals, including evidence-based practice to prevent and reduce falls in inpatient hospital settings. And how I achieved this objective is I reviewed the 10 nursing journals. I also reviewed the policy on fall prevention from Bon Secours, that's the hospital I'm employed with. And then I also reviewed VHA's fall prevention policy. I also utilize learning materials on my unit, which is an intermediate surgical care unit, for 2 weeks. I accomplished this objective by showing staff members my fall prevention pamphlet during huddle morning and evening. And then I revisited the pamphlet after 1 week. And then the last objective was to evaluate the effectiveness of the pamphlet. I did that by providing a summary of the survey answers to my instructor and then also writing a paper analyzing the project. All right, I'm going to go ahead and show you guys the fall prevention pamphlets. I'm going to escape out of here really quick. All right, so my pamphlet is here. On the front page on the right, you have the fall prevention tips for patients in the hospital. I used a little cute slogan, keep safety in mind every step of the way. And then I also intentionally cut off this end so that you would flip to the next page. So I've added some Bon Secours Mercy Health fall prevention policy information on the left there. So that'll be the first thing you'll see when you open up the pamphlet. I thought this was very important since I was launching this project at a Bon Secours facility for people to familiarize themselves with our actual policies. The policy basically states that we're going to assess our patients every 12 hours with the Morse fall risk assessment, and that nurses can use clinical judgment to override those scores if needed, but not to take away interventions because we have a lot of new graduate nurses and we want to make sure that they're honing in on their skills and learning best practices before we're having them, kind of use their clinical judgment because that's learned and not given as soon as you're a nurse. So when the scoring changes for any reason, intervention should remain in place for 24 hours or until discharge. And then there's a bunch of fall assessment tools under here. And then what precautions to take for a standard fall precautions, moderate fall risk interventions, and then high fall risk interventions. And then I also added if the patient refuses any fall risk interventions, it has to be documented. So why are preventing falls so important? That's going to be on the last part. I really wanted to hit home on why it's so important to make sure your patients are not falling. And that's because falls increase the risk of injury and death, the length of the patient's average hospital stay, and the cost of receiving care. So they caused over 38,000 deaths in 2021 in adults over the age of 65. And that ended up being the leading cause of death and injury for that age group in the hospital setting. It also increased the length of hospital stay by an average of 6.9 days to 12.3 days. And the total cost was 62,521 to that's the total cost of a fall. And then the average cost for a fall with injury was 64,526 just last year in 2023. All right, and then the inside of the pamphlet is going to tell you who is a fall risk, tips on how to prevent falls. And then that included the top 3 ways that I found in my nursing journals, which is educating your patient, to use the call bell before ambulating, assessing your patient with the MORS fall risk tool or whatever tool, fall risk assessment tool that your organization wants you to use, and then the use of alarm systems with virtual safety companions or telesitters. So those telesitters were a heavy hitter during my research. They were in about 6 out of the 10 nursing journals I used. And then fall prevention education for patients and family members and frequent rounding at least every 2 hours. Jump back over to this pamphlet here. To my PowerPoint, sorry. Okay. So the second way I completed my objective was by creating a survey and sharing the results with my instructor. The link to the survey is down below, but I'm going to show you guys the one with the results of the survey. So there are 10 responses to the survey currently, whereas I only had 7 when I turned the project in. So we'll look at that real quick. All right, so how frequently do you implement fall prevention methods daily in your daily nursing practice? 8 people said always, 2 people said often. That's great. That means most of the time we're doing what we should be doing. Which fall prevention methods do you commonly use? So 9 out of 10 said bed alarms and non-slip socks. 8 out of 10 said patient education and frequent rounding. 7 out of 10 said use of assistive devices, and 5 out of 10 used environmental modifications. So lots of wiggle room there on things that we should be doing that some people are not doing. Did the information provided in the pamphlet change your approach to fall prevention? So no one said not at all, which is great. 1 person said slightly, 4 people said moderately, and 5 said significantly. So I will take that as a win. How easy was the information in the pamphlet to understand? There was a lot of information, so I can see how it might be a little more difficult to understand, but everyone was kind to me and said very easy to understand, and 1 said it was easy. So no one said neutral, difficult, or very difficult. What suggestions do you have for improving the fall prevention pamphlet? 4 people skipped this question and 6 answered it. There were responses like using the adding how to use the gait belt, and then also the MORS fall risk like instructions, basically. Then how would you rate the effectiveness of your team in preventing falls? 2 people said very effective, 7 said effective, 1 said neutral. So a little wiggle room there. We definitely want to be very effective in preventing falls. And then I said, how many years of nursing experience do you have, just to, gauge this question out there. Less than a year was 3, 1 to 3 years was 5, 4 to 6 years was 1, and 7 to 10 years was 1 as well. More than 10 years was 0. Makes sense. We have a lot of new grads with 1 year or less experience. So, and then what additional fall prevention strategies would you suggest that I add to the pamphlet? Unfortunately, I can't get the answers to pop up here, but a lot of those were not applicable or none. All right, we'll go back over to the PowerPoint here. All right, specific outcomes for the nursing unit. So the annotated bibliography gave me greater insight into the evidence I got to use in my pamphlet. Creating the pamphlet allowed me to help my peers become safer nurses. Presenting the learning contract to my peers allowed me to teach and get real-time reactions from each learner. Launching the survey showed if my pamphlet was helpful or not on the unit, which it looked like it was. And then the survey results also helped to show if the education I provided was useful to the peers. The way I'm applying this project to my current practice is by making decisions related to fall prevention based on my nursing expertise, which is almost 4 years, but also adding new methods based on my research. I got that from the ANA, and that was cited from 2023. It also allows me to be more proactive with the fall prevention strategies I learned about within the pamphlet. And then I will also be able to create more pamphlets or your learning projects for my unit as needed. As you guys know, I love to create, I love to do art. That's something I do in my spare time. How does this value my lifelong learning experience? I feel like this enhanced education for better patient outcomes for me, enhanced my communication strategies with peers. It increased nurse autonomy and confidence in decision making. And it also provided scientifically supported research to help make well-informed decisions. Also enhances our critical thinking skills because we have more confidence and we can make more of those decisions and think more outside of the box. And then I have my references here. And that is it. Thank you guys for showing up and watching my video. I really appreciate it. Let me stop here.